Hello, good morning. Thank you to the organizer for this invitation. Hello. Today I'm going to speak about what have we learned about lupus registries around Latin America, and this is our conflict of interest regarding GLADEL. GLADEL means Grupo Latinoamericano de Estudio del Lupus. In English is Latin American Study Group for lupus patients. And GLADEL was developed in 1997 in Mexico. Here you can see in the middle, you can see Donato Alarcón Segovia and the first group that was showing in Instituto Nacional de Nutrición in Mexico City. Why was GLADEL created? GLADEL was created because we have limited of local information about SLE in Latin America, and also we have the challenge at that time to discover our own reality and not to copy information that were coming from abroad. We also have the perception that Amerindian and Mestizos SLE patients population had worse prognosis than Caucasian population. This is our first cohort, the GLADEL Multinational Latin American, that is a prospective cohort. It was a longitudinal inception cohort where patients were recruited with disease diagnosis less than 2 years. As you can see in this picture, this is a multinational, multi-center, and mainly multi-ethnic cohort where those are the main population, Mestizos, Caucasian, and Afro-Latin American. This is the GLADEL network around Latin America. GLADEL network is constituted by 34 centers distributed in 9 Latin American countries. More than 120 researchers are working in this group, and we follow 1,480 patients at this time, more than 10 years of follow-up. Those are the GLADEL history and milestones. In 1997, GLADEL inception cohort started in Mexico City. In 2002, GLADEL became as the PANLAR Study Latin American Group. In 2013, GLADEL organized, we have the honor to organize the 10th International Congress on SLE in Buenos Aires. 2014, GLADEL 2.0 was developed. GLADEL 2.0 means a new generation of researchers, lupus investigators that were their formation abroad, Latin America, and came to the Latin American countries of origin, and we started with the new generation that means less than 40 years of age. 2018, the first Latin American guidelines of the treatment of SLE was published in Annal of Rheumatic Disease. 2017, we started with the other branch of GLADEL. GLADEL is mainly scientifically, but now we are working in education. And let's talk about lupus, led by Cristina Drenker, that is a GLADEL, but working at Emory University in Atlanta, United States. And 2019, GLADEL 2.0, the new cohort that studied biomarkers of patients in Latin America was developed, and we are right 2 years ahead, and with almost 1,000 patients recruited in this cohort. In 2022, GLADEL education started with is lupus is Lupus is a education program that is directed to primary care physician that, of course, are the physicians that enter in the first stage with patient with SLE, so we need to start working with them. Those are one of the main highlights in GLADEL is a publication in Index Journal, and GLADEL own study from their first cohort. We have more than 40 papers published in Index journals, and of course we work also in collaborative studies, in this case with the group of Marta Alarcón Riquelme, working in Cheles, and Lumina from Chela Alarcón, and we have already more than 60 publications with these collaborative studies. This is one of the main key findings from GLADEL, that is, we characterize mestizos, that is the major ethnic group in Latin America. Mestizos have low level of education and socioeconomic status. Also, mestizos SLE patients were more likely to have familial autoimmunity, and from the genetic point of view, Amerindian ancestry increased the presence of risk alleles for SLE in mestizos. And the other main point is that we have done some GWAS study, genome-wide association studies, that show that the interferon regulatory factor 5 gene was the most representative one. As you can see here, these are the GWAS from the United States and from Europe, and you can see here the main peak is for the HLA genes. And, but when we study mestizo population in Hispanic in North America and mestizos in Latin America, the main peak, as you can see here, is not HLA, is the second peak. The main peak is the interferon regulatory factor 5. So we can say at this time that Amerindian and mestizo population are different from what was published in other parts of the world. Also, mestizos have earlier age at disease onset, higher disease activity and accrual damage, higher frequencies of renal disease and also develop earlier, and one of the most important things is they die younger than Caucasian population. So this figure speaks by itself, saying that being mestizos of lower socioeconomic status in Latin America is a burden of poor prognosis. This is the other part of the GLADEL that issue that showing that more than 10 papers published showing the benefit of antimalarials in the treatment of patients with SLE, showing that antimalarial protects against activity, especially in renal disease of lupus patient, but also delay the onset of lupus nephritis, protect against primary care cardiac disease, hematologic abnormalities, thrombosis, flares, serious infection, damage accrual, renal damage, and also protect from mortality. More than 40% of our patients was survived due to the use of antimalarials. And now we are working in the new GLADEL cohort, that is a cohort that started in 2019 with this group of young rheumatologists coming from abroad. And here you have the map of active participants of GLADEL 2.0, more than 120 researchers from 43 centers in 10 Latin American countries. And this is the study design, and you can see here we divided our group in 4 groups with lupus without nephritis, lupus with prevalent nephritis, active and inactive, and incident lupus nephritis. And so we plan to make serum, urinary, and transcriptome biomarkers in our population. So this is what we are doing, and I leave you with this. Thank you for being here and listening to us. Thank you very much.